So you and your surgeon, I mean, this is a partnership thing. You're in it together. You attend us looking for a professional, and we have some fantastic surgeons in this country. You've got to appreciate that we do regular appraisal and we have our outcomes and stuff scrutinised all the time, so we have a very, very high calibre of surgeons. When you get into the private sector, that scrutiny actually increases and it's really quite intense. So we know that we've got very, very good doctors in the NHS, very, very good surgeons in the NHS, and also in the private sector. The partnership approach starts from the very second you walk through the door. You tell them what you are suffering, you tell them your expectations, they discuss your condition, give you all the available information, and help you make an informed decision about what we do for you, what sort of lenses we use, what technique we use, when we operate on you, and whether we should operate on you as well. Often the best surgeons are the ones who say, actually it's not broken, leave it alone. And often I turn patients away saying, it's going to get worse with the passage of time. You're coming privately anyway, so there won't be a big delay to your surgery, so why not wait until it gets a little bit worse? Asking your surgeon questions is really important. They'll discuss risks of complications. There's no problem asking them, what is your complication rate? How many cataracts do you do? What lens would you have inside your eyes if you were in my position? We can't tell you what to do, it's your decision, but we can give you all the available information so you can make an informed choice. It's entirely reasonable to ask questions, but in the end, it's a pretty safe thing to have done. Engage with your surgeon. If you walk out of the room and you're not sure about something, you can always contact their secretary again or email them, because it's really important that all of your questions are answered before we have the surgery. It's too late to answer them afterwards, and it's too late if something goes wrong to then ask the question about it. You've got to know that the surgery is very safe, but it's not completely risk-free, and answer every question you can think of. Often writing them down makes sense before you go in, and certainly if we're going to do something clever with you, correct your astigmatism, give you a premium monofocal lens or a multifocal lens, then you need to really understand what the implications of that are, what the plus sides are and what the minus sides are, and then so you can make an informed choice about things. But I'm really confident. I see my colleagues working all the time, and I do a lot of medical legal work, and we've got a fantastic calibre of surgeons working here in this country privately and within the NHS.